An intense heat wave is sweeping across North India. Delhi, Punjab, Haryana, Uttar Pradesh and other states are fighting unabating heat conditions. In the capital, power demand surged to its record as temperatures remained above 45-degree mark. And the prolonged heat wave has now led to a massive spike in heat-related health issues, and cases of heat stroke and dehydration are on the rise across India. The Health Minister reviewed preparedness and issued an advisory to all government hospitals and medical colleges to give priority treatment to those who have been admitted due to heat wave. He also directed officials to ensure special heat wave units are started so that the best possible care is given to patients. We have some breaking inputs coming in as well. So on one hand, you have these instructions coming in from the Health Minister. We did a reality check from the Delhi government hospital on whether or not the instructions are being followed, and the hospital staff reveals the grim truth. 70 bodies brought to the mortuary in just 24 hours. 70 deaths in 24 hours. That's the confession on cam. 4 mortal remains on one stretcher. That's the condition at the moment in the hospital. Delhi has been hit by a prolonged heat wave. We're getting you a special reality check from Delhi's Deen Dayal Upadhyay Hospital. Times Now spoke to an official who confirmed that over 70 dead bodies were brought to the hospital mortuary within the last 24 hours, and the mortuary has reached capacity. It's a Times Now special report. Take a look.
कल से 70 आ गई है 70 टेस्ट कर रहा है यही जगह ना वहाँ लगेगा सामने 2 बजे मोटी भर गई पूरी बॉडी ना रखी बॉडी एक स्टेशन में 4 बॉडी है एक स्टेशन में 4 बॉडी सब गर्मी की वजह से
Priyank and Sabyasachi joining us on the broadcast. Let me first go across to Priyank. This is worrisome, the situation in the national capital. One of the hospital staff there confirming that 70 dead bodies were brought in just 24 hours and that the mortuary in fact has no more space to keep more dead bodies.
Yes, certainly, Swati, and what we got to know that over more than 40 bodies were shifted to only DDU hospital. But time and again, what sources have been suggesting that since the government always try to lower down the data, the cause of the death in these hospitals could have been written pneumonia, heart attack, and other things. But it was a fact when we spoke to one of the doctors who came, who told it to us without coming on record, that the deaths have happened because of the heat wave. We spoke to one of the CISF person's family member who was posted at the IGI airport. He also said that the death of his brother happened because of the heat wave, and there were several incidences which was showing that the death has happened because of this. The official data from the DDU hospital is of 45 in this month, but when we accumulated all the bodies which were present at the spot, when we saw that if you can see in the visuals, there are racks which have been placed where multiple bodies have been kept. Till 2 days back, the number of bodies, unnatural death cases, which were reported at this particular hospital were only 10 to 12. But suddenly, within the last 3 days, more than 40 bodies have been sent to this location, which is certainly showing that unnatural deaths have increased. What doctors have been suggesting that this is because of the heat wave. This is what also this particular security in charge of the emergency area has told it to us.
All right, Priyank, stay on with us. We have some more breaking inputs coming in. Let's take a look at what the forecast says. So it is predicting a little bit of relief for the Delhi NCR region. That's what we are picking up. Amid light drizzles in some parts, so there's going to be a brief relief. We have Sabyasachi as well on the broadcast. Sabyasachi, brief relief. That's what we can say at the moment for the citizens of the national capital region.
Well, absolutely. See, a brief relief would be get by the citizens here in the national capital from the scorching heat. We have seen that for the last couple of days, how the mercury here in the national capital has been continuously increasing. On one hand, the people of the national capital has to deal with the water crisis issue, and secondly, they have to deal with the scorching heat. Meanwhile, from the Delhi government, Saurabh Bharadwaj, in fact, have spoken to all the Delhi government-run hospitals here in the national capital to increase the number of beds for the patient who are complaining of heat stroke. So that is the reason why we are seeing that people here in the national capital are continuously suffering because of the rising temperature. But today, as far as the Met Department is concerned, they say that people here in the national capital will get some relief from the scorching heat today.
You to be with us on the broadcast. On one hand, the situation on ground is such that, according to the hospital staff of Deen Dayal Upadhyay, 70 dead bodies were brought in just 24 hours. That's the impact, and that's how people are suffering due to the heat wave. On the other hand, forecast says there's only a brief relief. Let me go back to Priyank. Priyank, the health minister has issued some advisory. The big question is, are they being followed? Are patients who are suffering because of heat wave being given priority?
See, Sati, those patients who will be brought to the hospital will be given priority, Swati. But we are talking about what happened before that, because the lack of, drinking water and all these water coolers, which should have been ideally placed by the government at several locations, are missing. It is a known fact that in case when the winters come, they are the wooden, places, sticks which have been, or the wooden material which has been kept for the people to get some relief from the temperature. But in this case of scorching heat, the government was not prepared. If you look at the data which has been given by several hospitals, Swati, it is quite clear that the number of deaths have increased in the last 4 days. But the government has, the central ministry have now come on record and said that the hospital will have to give preferences. What we have got to know that most of these cases are suddenly referred to the central or the state government hospital by the private hospital without giving proper care and thinking that the patient has a very high fever. In most of the cases, the patient have got 108 to 110 fever because of the body suddenly becomes dry, the body temperature rises. So there's no proper method which has been opted by the hospital at several emergency units of the private hospital.
That's the need of the hour, given the heat wave situation in the national capital and across the North India, in fact. Priyank and Sabyasachi, stay on with us. We also have Pratibha joining us on the broadcast with more details on the forecast. Yes.
Yes, Swati. So it looks like there could be some respite from the heat wave. Yesterday there was strong wind. So let's just go through the 4-day forecast that has been issued. It looks like from the 23rd to the 25th there's going to be a heat wave, but for now there is some respite because for today the prediction is partly cloudy sky with possibility of rain or thunderstorm or dust storm, and the maximum temperatures, there's a slight drop from yesterday. Yesterday the max temperature was at 44 degrees. There's a slight drop to 42 degrees, the minimum temperature being 33 degrees. So it's going to be slightly better today, and the situation is going to continue tomorrow and day after as well, because the minimum temperature is going to be 32 degrees and the maximum being 43 degrees with strong surface winds being predicted not just for tomorrow but for day after tomorrow as well. But unfortunately after that the heat wave will pick up again from the 23rd to the 25th. Yet again a heat wave warning has been given, with the temperatures rising not just to 44 but to 45 degrees on the 24th and the 25th. So that's a prediction that has come in, Swati.
So there's going to be a brief relief from the heat wave. It will pick up again, like Pratibha has been telling us. Priyank, Sabyasachi and Pratibha, stay on with us. Let's once again take a look at that special report filed by Priyank, where the hospital staff admits that 70 people lost their life because 70 bodies were brought to the hospital in the last 24 hours.
यही लगेगा ना, वहाँ लगेगा सामने 2 बजे मोटी भर दी है पूरी। बॉडी ना रखी बॉडी एक स्ट्रेचर में 4 बॉडी है, एक स्ट्रेचर में 4 बॉडी सब गर्मी में हो रहा है।
Priyank continues to be with us. Priyank, and this is just one hospital that we are talking about.
Yes, Rabi Swati. This is only one hospital, but when our colleagues also try to get the cumulative data from other hospitals, the number of deaths which were stated by RML or the other GEB Pant and other hospital was coming in between 5 to 6 deaths, per day in the last 2 to 3 days. But we are talking about this particular zone because we focused on this western zone because most of the laborers stay in this area, like Kapashira and Lohini, Dithala. All these areas are the ones which suddenly comes under the domain of this particular hospital. There are 28 police station jurisdiction which comes under this DB hospital. That's why we, when we went there, you can see that how the bodies have been kept on the rack. Generally, there are 8 to 10 bodies which are claimed to be unnatural death, and they are sent to the mortuary. Forensic postmortem report. But what the staffs were also indicating that most of the cases, because the government is under pressure, they pressurizes the medical team to come up with a result which is similar to pneumonia or the heart attack or something other which does not symbolizes that the patient could have died because of high heat and fever. So these are the basic factors. You can see in the visual which is right next to...
Absolutely. The government needs to look at this. There are some irregularities as well.